Good but not enough. Free health coverage to all over 70 years is good, but more needs to be done. In a welcome move, the Union government's decision to extend the coverage of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana ABPMJ to senior citizens over 17 years, irrespective of their income, provides a modicum of free health coverage to nearly 16 million people. With out-of-pocket expenditure for health care in India among the highest in world, the decision is indeed laudable. While the decision to provide free health coverage up to 0.5 million per year for a section of the population is novel, it will in no way fulfill the public health objectives that are much needed for the targeted beneficiary. First and foremost, the health insurance scheme is limited to secondary and tertiary care hospitalization. The absence of coverage for outpatient care, diagnostic and medicines is particularly concerning as chronic diseases have increased sharply in India in the last few decades. Increased life expectancy and an earlier onset these diseases would mean that people over 17 may very often suffer from multiple chronic diseases. Most of healthcare expenditure by the elderly will therefore be through outpatient care 40% to 80%, which will not be covered by the scheme since it launched in 2018. The penetration of PMJ into smaller cities and towns has been low in most states. Unlikely in most of the southern states, primary and secondary health care in the public sector has been largely neglected and is inadequate and ill-equipped to meet the demand in the other parts. Robust primary and secondary public health care will be sharply cut the load on tertiary health care and hence the need for curative care. A reduced curative care load at tertiary hospitals will make the PMJ scheme succeed. Thailand focus on and progressively strength, strengthen its primary health care system and even diverted funds earmarked for urban hospital to build rural hospital and health centers to attain universal health coverage. In contrast, in the US, makes banking primarily on insurance-based scheme is that led to be surging cost of healthcare. India appears to be going the US way, though there is a warning enthusiasm 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 in the private sector due to low treatment rates and delay payment. As per media reports, since it launched, two-thirds of the total money spent each year under the PMJ scheme went to private hospital. It was 35% in the case of the southern state. Weakened primary and secondary healthcare will result in an overload in tertiary healthcare, which is the private players will be well poised to take advantage of. This can lead to a further shrinking of government commitment to strengthen the public health care system by the over relying on insurance modality which is neither affordable for nor will provide appropriate health care for the needly needy in its present form, PMJ is a measure that essential but is incomplete.